Hi, my name is Dr. Mark Burdar. I'm a board-certified chiropractic neurologist, Scottsdale, Arizona. Today, since the month of October, I want to talk to you about the hazards of sugar and how cancer can be made much worse by sugar. Okay, and let's talk about diabetes. And diabetes was originally discovered by Egyptian doctors over 3,000 years ago. And then a guy named Himsworth in 1936, he was a British scientist that actually came up with the concept of type 2 diabetes. So here's the situation. There's something called insulin resistance. And back in the 1700s in the United States, the average consumption of sugar by an American was 10 pounds. Sadly, today, that's over 200 pounds of sugar that we are ingesting. So the problem is when we keep introducing so much sugar into our body, your body uses something called insulin to metabolize it, and after a while it just gets overloaded and it no longer works. And that's what insulin resistance is. Now the sad thing today in the United States, we have over 100 million people that suffer from insulin resistance. And what happens is that original symptoms would happen is you get tired after eating, you have a poor sleep cycle, and fatigue. Okay, well then as that progresses, you get worse things happening like ovarian cyst disease, guys get low testosterone levels, and insomnia, hypertension. The big thing is obesity. So when I always talk about comorbidities of COVID and stuff like that, well, it's all disease processes, whether it's cancer, cognitive decline, or cardiac involvements. So how do you address this? Well, get tested. Okay, and some of the basic tests you can do is something called an A1C. It's also called the hemoglobin A1C, and look at the triglyceride levels in your lipid panel on blood work. So if these are abnormal, then there's a lot of things you can do to take measures to improve it. Okay, and the big thing is high intensity training as far as doing some exercise, try to lose weight. This is things that help to lower your blood pressure as well. And there's a couple supplements you can take. And one more test you should look at. I'm always talking about vitamin D. Okay, vitamin D, if you're vitamin D deficient, it basically causes insulin dysregulation, which once again juggernauts into this whole concept of insulin resistance. So get your vitamin D level tested. Now, there's many supplements you can take, and one of my go-tos is something called berberine. And if you take 1,500 milligrams of that a day, see if that does not also help you to lose weight, which once again diabetes type 1, the only difference between type 1 and type 2 is type 1 is genetic, okay? Whereas type 2 is basically lifestyle, and as we age, and more importantly, as we get overweight. So the thing is, if you can reverse this stuff naturally, and sometimes it does require medication, but the important thing is do blood work on yourself. And if you put that blood work in front of me, I can give you ideas and strategies to improve your health. Because the sad thing is, yes, October is breast cancer awareness. Well, vitamin D deficiency is also related to not just breast cancer, but colon cancer and 13 other ones. So I hope you learned something from me today. Have a great day.